Hi. I hope you've opened your email and you're reading this little post-operative note. First of all, your surgery went great. Your eyes look beautiful. And now to make sure that you have a comfortable, immediate post-operative course, there are a couple do's and don'ts that you should prescribe to. First of all, do rest in bed with yourself about 45, 60 degrees sitting up in this position. It's probably a good idea that you keep ice around your eye ground area for the next 12 to 36 hours. Over the suture lines where the steri strips are, you put a little bacitracin ophthalmic here, bacitracin ophthalmic here, close your eyes gently a little bit here, and a little bit there. Over the steri strips. The steri strips are there to help expedite your healing. The ice is important. If you've chosen to freeze some of those peas in those little baggies, those are great because they'll conform beautifully for your eyes. Keep the ice on around the clock. It's important you don't get an infection, so I've written you for prescriptions, and usually if patients are not allergic to penicillin, I give them Duracef to take twice a day. I give you some Percocet pills to take for your pain. I recommend you buy a pill cutter so you cut the Percocets. Take 3 Percocets, cut them into quarters so you have 12 little pieces. And if you have a little discomfort, take 1 little piece, let's just say at midnight. Wait 20 minutes. If you still have some discomfort, take one 20 minutes later. If you have a little bit more still discomfort, take another one, so it's now 12:40. I suspect that you're probably going to find that by breaking up the Percocet into little pieces and taking them as you need, you'll 1, take fewer Percocets than you need. 2, you won't get the side effects that go along with the Percocet, like nausea, vomiting, constipation. 3, and it will alleviate a lot of pain. Certainly I'd like you to make sure you eat and get good nourishment in that immediate post-op period, but don't go right to a steak dinner. Start off with some clear liquids, ginger ale, Coca-Cola, then maybe a little more substantial food like maybe tea and some toast. And if you're doing well with that, try yogurt, chocolate pudding. And if you're doing well with that, then some pasta, maybe some spaghetti, and maybe even a steak. Anyhow, your post-operative course should be uneventful. It's important that you're able to see, so every once in a while take the ice pads off. Look, see if you can see things. It's probably going to be a little blurry, but that's normal. If you find you have swelling more on one side than another, give me a phone call. Let's check in, make sure there's nothing else going on. You'll have my cell phone. Hope you have an uncomplicated and comfortable evening, and give us a call if you have a question. Have a great night, and I'll see you tomorrow in the office.